everyone, my name is Himangi Kaushal and I'm an alumni of the 1994 batch of GMC Amritsar. It's an absolute honor to be invited to speak on the occasion of the centenary of the college. Unfortunately, we're in the midst of a pandemic, so in keeping with social distancing guidelines, I'm recording this video from home. I'll start with giving you an overview of what my career path has been since graduating. Immediately after college, I moved to North America and completed my internal medicine residency and chief resident year at University of Illinois. That is where I got the opportunity to start my academic career as core faculty. Eventually, I moved on to serve as the associate program director at the University of Miami program in Palm Beach, and then as the founding program director for two separate residency programs in South Florida. Currently, though, I'm taking a short hiatus from academic medicine and pursuing my MBA in health sector management and policy. Yes, I'm a glutton for punishment. Learning never ends. So, the last time I was in the college campus was in 2016. After a long gap, I was amazed to see the changes that had been made, the technological advances that had occurred. You have to remember that I graduated in the year 2000. It was a time when, if we wanted to make long-distance phone calls, we had to walk across the street from the girls' hostel to this tiny little place called the PCO booth or the STD booth. You guys probably have no idea what that is, or maybe have a completely different interpretation of that acronym. Anyway, when I think back to my college days, there are a couple of things that I'm incredibly grateful for that I would like to share with you. And if they resonate with you, I would say maybe spend some time developing those. The first one is that medical school is a great place to truly find your passion. We often get into medicine because we're smart or it's the path that's been laid out for us. But this is the time for you to immerse yourself in different aspects of medicine and figure out what you're truly passionate about. Medicine is a profession where people come to you at their lowest points. So if you're not truly passionate about what you're doing, it's going to be impossible to raise the spirits of your patients. The second thing is to find people who share your passion and to forge lifelong friendships. My roommate and I still keep in touch. We talk almost every day. I'm still in touch with several of my classmates from med school. And it's a great way to reminisce about the good old times or the not so good times. But trust me, with time, they all become fond memories. In fact, recently I checked out a WhatsApp group that our classmates have started, and I was pleasantly surprised to see everyone volunteering to help each other, despite not having talked to each other maybe in decades. These are the bonds you form because you've been through some tough times together. So cherish that. And finally, before you get tired of listening to me, I will say there is no secret sauce for success, and success looks different for different people. The practice of medicine is challenging no matter where you are, but it's also highly gratifying. You will each find your own path. You can be a rebel, you can be a conformist, or you can be a little bit of both. But keep in mind to pick your battles and to always find joy in what you do. And before I wind up, I do want to say that during this pandemic, as medical students, you probably don't hear this often enough. But what you do every day has a huge impact on people's lives. So thank you for that. And good luck and stay safe.